The most evolving treatment, also the most revolutionary of treatments available nowadays for acne, is photodynamic therapy. I feel very strongly about photodynamic therapy. In my opinion, it can, in many instances, replace the need for all antibiotics that are unnecessarily given for long periods of time. It is very, very similar in results to isotretinoin or Accutane without the need to exposure of chemicals that some people may be very fearful of. Photodynamic therapy works by incorporating a medicine, a substance called levulinic acid, into our oil glands. It is then activated by red light and blue light, and that particular activation causes destruction of the oil glands, not of all oil glands at the same time, but of a number of oil glands. Oftentimes it results perhaps in shrinkage of some oil glands first before it can completely eradicate that oil gland, but that turns off the acne. And don't worry, we have plenty of oil glands on our face and we really don't need all of them. So we apply this medicine on a cleansed face. We then let it sit on the skin to be able to move it into the oil glands for approximately an hour or two, sometimes longer than that, sometimes less than that. It depends a little bit on the characteristics of your skin. And then we're exposing your skin to the light source after that. And the light source that the aminolevulinic acid is most receptive to is blue light. However, red light seems to also have quite some activation power, and so oftentimes we combine it with red light as well. At the end of the treatment, you leave the office covered with sunscreen and oftentimes even a sun protective hat if it was performed on the face. The sun protection has to consist of either zinc oxide or titanium dioxide. It is crucial to avoid the exposure to visible light for 42 hours after the treatment, and that is to avoid that there's further activation of the medicine that still remains in your oil glands. What you can expect over the next few days, and that may already start on the day of the treatment, is redness and swelling. By about day 3, the skin will feel very, very tight, and by about day 4, that tight skin will start shedding off. There are some people who get more pronounced reactions and may have some redness to a certain degree for up to 10 days in their skin. Some may even get very pronounced swelling. That is a subset of our patients. Certainly doesn't affect everybody. Most of the time it goes very, very straightforward. It is oftentimes a series of 4 to 6 that are spaced anywhere between 2 to 4 weeks apart that gives best possible results. And those results can in the majority of all patients treated, result in complete eradication of their acne. So what's the success rate? About 75% of people who are treated with 4 to 6 treatments of photodynamic therapy will be rid of their acne by completion of the treatment.